published online via ModGov or from the council website. When you are called to speak, if I can ask members to clearly state for the benefit of anyone that is listening who you are and where you're from. The meeting is being recorded for audio by the council. The recording will be retained in accordance with our retention policy. Fire drills. I'm not aware that we are expecting any this morning, so if one goes off, please form an orderly queue behind Councillor Baker, who will be our nominated fire marshal for today. Do we have any members of the public with us today? I've not been informed, but welcome if anyone is. No, that's fine. I'll start the meeting proper then. So, good morning, everyone. I'll start with apologies for absence. I've got a little list today. So, Steve Ashton, Tim Curley, Andy Sully are all unwell. Norman Cavill's got another meeting, I believe. Help me. Simon's substituted for Edric, so welcome, Edric. Any other subs or apologies that anyone would like to give? No. Okay, that's everyone we're expecting. Daniel Thomas, who was due to present the health and safety report item 5, is unfortunately unwell. So I believe Alan is substituting for Daniel today. So welcome, Alan. Maria is also unfortunately unwell today. So just to let you know. So I'll move on to item 2, which is the minutes for the last meeting, which was held all of 2 weeks ago, I think it was, wasn't it? 27th of November. Firstly, for matters of accuracy, does anyone have anything that they would like to raise? No. Any matters arising not covered elsewhere on the agenda? No. Is everyone happy to accept those as a true record? Yeah. Proposed. Habib, seconded. Mike. All those in favour? Perfect. Yeah. Any abstentions? Thanks, Cedric. Anyone voting against? Yeah. Perfect. So I will sign those as a true and accurate record. So moving on to item 3, which is declarations of interest. All members are encouraged to update their declaration of interest with Democratic Services if anything changes. So I'm going to take those as read. Is any additional declarations that anyone would wish to make at this time? No. Perfect. So moving on to item 4, public question time. We don't have any formal public questions tabled. I'm not aware of any members of the public. Oh, sorry, we've got Councillor Richards from Yeovil Town Council. Thanks, Ashley. So move on to item 5, which is the Health and Safety Governance Internal Audit Report. So I've got Alan to present. Morning, Alan.
Good morning, Chair, and apologies I can't be with you in person today. Daniel also sent us apologies. Unfortunately, as you mentioned, he's not very well, so I'm afraid I'm his poor substitute today. Thank you for the opportunity to bring this back to Audit Committee. You'll see from the report, and it's quite a comprehensive document that's been put together by Daniel. Effectively, what you can see here is the key recommendations that were identified as part of the audit that was completed by SWAP, and I'll come back to the reason for the audit in just a second. But what we have done here is effectively set out each of the key findings and progress as part of the updates that we're going through. As part of this, of course, there is a number of matters that will simply be business as usual as we go through our transformation program. So health and safety and the development of it simply won't stop. This will be part of the process that will continue to roll out. But if I could just go through some of those key findings. Before I do that, just to remind Audit Committee that this was an audit that was requested by the service, by me in fact, in order to ensure that we had a good understanding of the culture of health and safety that we were effectively inheriting from the 5 legacy organisations as we went through LGR, but also then to set out a clear plan of action, not clearly and only about compliance, but one that actually focused on how we are improving the culture of the organisation around health and safety matters. Compliance, in my view, is one thing, but actually getting the culture right around health and safety helps and supports ensuring that we are compliant with all of the relevant regulations. Keeping our staff and our residents safe is part of that, but clearly the culture is the key step in achieving that. So first and foremost, in terms of the findings, if I can just direct members to the report itself, and I won't go through every word, of course. One of the key things was around making sure we had clear health and safety governance arrangements in place and they were fully embedded. I'm pleased to report that we have health and safety boards in place across the organisation, and they are being led at a senior level. Service director is a minimum across the organisation now, and we have those nominated as part of the process. There was a delay in getting those in place, mainly as a result of the restructuring efforts that were around layers 2 and 3 of the organisation. Now that that's complete, we're now going through making sure that all of those have been nominated and those boards are up and running and reporting appropriately. The second one related to the corporate performance reporting of health and safety matters. And whilst there were reports around our health and safety reporting, they were being either held in directorates or not visible at a corporate level. I'm pleased to report that they are now moving forward and we have completed that activity and action. That's not to say there aren't improvements that can always be made to that information, but particularly I would direct members to our intranet site, and the links have been embedded into the paper. All of the performance data that is now reported as part of our health and safety monitoring is available to all members of staff, members and the executive leadership team, and this is the information that we review on a regular basis. We also receive a report from Daniel now on all of the issues that are reported to the health safety and wellbeing steering group, and that is then also shared with ELT and service directors as well, so we can see key bits of progress and key issues as part of that document. I would also commend members to read the update around the award that was secured by the team for the work they've done on health and safety reporting. Again, just showing the kind of quality and the progress that they are making. I'm also pleased to say that we haven't bought or purchased a unique system associated with health and safety reporting. Now we are using the tools that have been provided to us and developed by us using the Microsoft suite that we're now making the best use of. Next one was around the monitoring of health and safety reporting around training completion. We've now embedded that as part of our health and safety reporting measures, but also that will form part of our engagement with our organisational development team. So it's embedded as part of our overall training package for managers and staff moving forward. And then finally, Chair, just in terms of the one item I'd just like to draw your attention to is we had a number of items that were found through the audit where there was a raft of information that wasn't up to date or complete. Daniel and his team have worked incredibly hard to ensure we have an up-to-date suite of policies and procedures, and where appropriate, they are regularly reported to the health and safety, the HR committee to demonstrate where those changes are coming through and ensuring that we have member approval before we implement those policies. At that point, Chair, I'm going to stop and happy to answer any questions you may have.
Thanks, Alan. Before I open the floor up to Rosemary, are you okay with the blinds there? Should we ask them to be shut? Thanks, Alan. Before we open it out to members, can I just ask what impact the transformation programme is going to have on the, you talked about tier 2 and 3, and the delay in setting up the health and safety boards. Can you give us some assurance that the transformation programme isn't going to take that progress backwards at all?
So certainly from a health and safety board perspective, Chair, the boards are in place. Clearly, as we go through the restructuring, we'll need to make sure that there are key individuals as part of that process. So there is a need to ensure that if there is a colleague that will be leaving through this restructuring, that there is a substitute in place as part of this process. I think where I can provide reassurance to Audit Committee today is that we now know clearly who needs to be represented on those boards, where the gaps may emerge, and Daniel has that record along with the chair of those respective boards to ensure that that gap is filled quickly as part of this process. So it's part of our overall restructuring process. So there is going to be gaps undoubtedly, but there is a clear mechanism to ensure that they are filled and filled quickly.
Okay, thank you. So members, opening up to questions on the floor. Rosemary?
Okay. Yeah, I was disappointed when I read this. We're 3 years almost into the new council, and it worried me that health and safety were being picked up now. It seems, and it hadn't been covered with the staff almost. I think that's what I picked up from the report. I was disappointed in the report, but I can see that you are putting in processes, but it's rather a long time to wait, isn't it?
Do you want to provide any comment there, Alan?
Thank you, Chair. Thank you for the opportunity to come back. So since 2 years since vesting day, as part of this process, we initiated this audit immediately after vesting day. So I initiated this audit immediately after vesting day to ensure that we were clear of the culture associated with the organisation. And what you're seeing is a progress update as part of this process. So it hasn't stopped, just to reassure members and Councillor Wood's query. This hasn't simply just started. This is an update and progress as part of this and an ongoing journey, if you like, associated with health and safety culture. The compliance element has always been in place. The compliance element has always been running in the background. But clearly we need to have a collective and a coherent approach to health and safety monitoring and its culture, and hence why this report is here and why we need to bring it together. So there were the mechanisms in place, but they weren't in a robust form, and that's the benefit we gained from the audit that we received. So just to reassure, this wasn't something an afterthought. This hasn't been started now. This was started immediately after vesting day and was part of the overall process in progressing to an operating model for health and safety that's appropriate for our organisation. Thank you, Chair.
Thanks. I got a little queue. So I've got Gwyl, I've got Lee, and then I've got Lindy and Habib.
Okay, thank you very much. Yeah, I think what I jotted down was, are we going fast enough? And picking up on Rosemary's point about, we're 2 years in. And then I was just going to ask about whether this is just a question of reframing health and safety in our image, in the Somerset Council's image, or was it perhaps a legacy problem from the 5 councils? You've just answered that we're just trying to reorganise the deck chairs. I think that's what you said anyway. So I think basically my concern echoes Rosemary's, that we're not moving quite fast enough. Certainly under 1.4 there is a lag on policy, and several of them are not being done yet. But I'm assuming that the policies, the legacy policies we have, are fit for purpose at the moment, and that you're satisfied that health and safety within the organisation is currently being adhered to, is under control. And whilst perhaps the framework that underpins it in terms of reporting and up-to-date policies may not be quite there, you have no concerns. Is that fair comment?
If I may, Chair, thank you for the question, Councillor Wren. I think the key issue is that I don't think we can ever have no concerns associated with health and safety matters. I think what I'm reassured, and how I can reassure Audit Committee today, is I'm reassured that we have an understanding of the nature of the issues we need to address and a clear programme in place to be able to address them. So, for example, a clear programme of policy reviews. There's never a time whereby all policies would be up to date at every single point. There is always legislative changes, or we take learning from it, from instance or examples of practice that we need to update. So as a result of that, I'm confident we now have a steady stream of policy reviews in place, that we have a clear and coherent programme of health and safety governance across the organisation. But clearly training, development and compliance is all part of that picture, and something that we need to continue to develop. So I would never say that I'm 100% happy, because there's always more that we can do. But I'm comfortable and confident that we are working at the pace that is necessary to ensure that our staff and the work that we complete is operating appropriately. But there is always an opportunity to work faster, I completely agree. But within the resources that are made available to us, we are working at the pace that's required to keep our staff and our activities safe. Thank you, Chair.
Just one supplementary. I think one of the key things about this is the reporting, in a way, so that you at corporate director level do have an understanding of how it's working across the organisation. It's not simply reporting incidents, it's making sure that we capture near misses as well. Are you happy that that's working well enough within the constraints that you've just outlined?
If I may, Chair, I think this is one of the key issues, if I'm honest, Councillor Wren, in that one of the key concerns is the types of cultures that we have inherited, that sometimes those types of near misses aren't reported, that in a number of instances, and this is a legacy issue in many authorities, that there are a number of staff that experience near misses that simply don't report them. They accept them as part of their daily work. That is not acceptable, and we've been really clear as part of our reporting, part of our training, that actually near misses are as important, if not more important, to report than the incident themselves. So that's why the reporting systems have been made easy. Also, we've moved away from the cumbersome process of reporting incidents, so it's far easier for staff to report those near misses, and we can learn from them, and you can see some of that information as part of the reporting. So I believe we're on the right path, and I think we're on the right in the right trajectory, but we're nowhere near complete yet. And that was an issue, by the way, for all legacy councils previously. So something that we know we need to work on, and all local authorities need to work on as part of reporting those near misses.
Thanks. Alan, for my benefit, can you just confirm who is the Senior Accountable Officer for Health and Safety? Is it the Chief Executive, or is it one of the Tier 2 directors?
Ultimately, it's the Chief Executive as part of that, but that designation is delegated to me under the Health and Safety Notice, but ultimately the Chief Executive is accountable.
Perfect, thank you. So who was next on my list? Was Lee?
Thank you, Chair. Good morning. Good morning, Alan.
Morning.
And thanks ever so much for presenting this report so comprehensively. I've just got a couple of questions. I do certainly applaud, take what Gwyl and Rosemary are saying in terms of perhaps it looks a bit of a slow burn, but I do applaud you for starting the ball rolling as soon as vesting day, Alan, so that's great. So we've got a line in the sand. We know where we are moving forward with the new organisation. A couple of things for me. I'm looking at training and competence and communication, and you mentioned that earlier, and I suppose for me there's a bit of a paradox here, because you've got training and competence marked as a good score, so most colleagues, you know, received health and safety training, but then communication, they're saying they're not sort of receiving too much communication. So I suppose from my perspective that looks a bit of a unbalancing the scales, and I just wonder if I can confirm with you, do you operate a process where every member of staff, so every colleague in the council, gets a mandatory training module, if you like, on health and safety once a year? I worked in a corporate environment. We had it every quarter, where you'd have a health and safety test or a health and safety module that you'd have to complete, so that everybody is singing off the same hymn sheet, so knows the processes and everything else. Is that the same in the council? Is that what you're embedding in the council, so that hopefully that will build the communication scores up as well as the training and competence, and everybody will know where they are on a health and safety footing, Alan? Thank you, Chair.
Thank you for your question through you, Chair. Absolutely, that's the key component. So as part of the, to allow members to kind of dive into the detail if you wish, there is an opportunity to review the nature of the training and compliance with the required mandatory training, of which is all members of staff are required to do, from the Chief Executive right through to our operatives on the front line. They're all required to complete their mandatory training, and that is a record against each service, and each service director, each head of service, each manager can dive in and see whether their staff have completed that and whether they've completed all of the necessary training as part of that process. I mentioned earlier, as part of my introduction to the paper, that one of the key items that we are doing is working with our organisational development team to make sure that it's part of those induction packs, but also as part of our ongoing management development and staff development processes. So you can see the evidence now, but it's definitely something that I would continue. I find that health and safety matters always need to be at the top of the agenda, and the minute you let that topic drop, that's where you get cultural issues. So for me, it's about embedding it in all of our processes, and hence the engagement with that organisational development team. But just to reassure Councillor Baker's question, absolutely, that's a clear list of mandatory training, and that is something that we report on through that corporate reporting that you can view.
Brilliant. Thank you, Alan. Thanks, Chair.
Lindy, good morning.
Good morning, Chair. Good morning, committee. Let me start off with applaud on, I also saw your nomination on the Public Sector Smarter Working Award and saving thousands of pounds for the council, so well done on that. The one question I've got is on page 16 with regards to the health and safety strategy. So I am concerned with regards to the comment on how far you are with implementing the action summary. So ironically, it states that the health and safety strategy, in the meantime, while you're still busy looking at it to be prepared, there should be a clear tone at the top for the interim period, right? And then in your update that you give, you say that there's limited resourcing, conflicting priorities, and ongoing transformation, and you've not progressed. I understand that you are trying to look at all the compliance issues and try and get that implemented. Well done on that. But I mean, the strategy is the overarching, most important document with regards to health and safety, because from there, all the other policies and things will filter through. And it's ironic that you mentioned conflicting priorities. I think that's a bad reflection if you quote conflicting priorities, where you should be setting the tone at the top. There should be a clear direction from the executive, and not to state to public that there's conflicting priorities, if that makes sense. Thank you, Chair.
Through you, Chair. Thank you for the question, Lindy. Incredibly insightful as always, and I thank you for the challenge. One of the key items is, and it's probably a product. Actually, I'll rephrase that. It is a product of vesting, in the sense that we need to ensure that all of the compliance was up to date, that all of the records were up to date. And I think what is being acknowledged within the report is a clear and honest reflection of the fact that we need to ensure that those were completed. What has been identified by Daniel as the lead for health and safety matters, and he has my kind of full and complete support for this, is there's now a need for that strategy, that effectively we have progressed well with what we need. We now need to set that overall strategy based upon how that's been identified. So it's an honest reflection of particularly where we are. It's an element of setting out the fact that there have been completing priorities by virtue of ensuring that we are compliant as we go through our restructuring, ensuring that we have all the necessary policies and procedures up to date. But we're now at the verge of being we can only take that so far without that wider and clearer strategy. So you're absolutely right. There shouldn't be completing priorities, but I'm afraid that is the circumstance in which the organisation is working in. And in fairness to Daniel, he's been working incredibly hard to ensure that he's balancing all of those priorities based upon health and safety incidents, health and safety practice, and ensuring our policy framework's up to date. And I think this is one of the key issues we need to ensure is led from the top of the organisation. And of course, the Scrutiny Audit Committee is incredibly helpful to ensure that we're compliant. But you're absolutely right to flag it. It is a concern and something that we need to refocus on, hence why it's in this report as a key area of focus.
Thanks, Alan. I think I've got Diogo next. So I formally forgot to welcome you to the committee, Diogo. So my apologies. Welcome. You've got very big shoes to fill from Mandy. I'm sure you'll do a great job. But as I said before the meeting, feel free to shout if there's anything particular that you want us to clarify or go over. So over to you to ask your question.
Thank you, Chair. I'll take small steps to fill that big gap. Thank you. Just looking at Appendix 5, and it's following on Councillor Baker's point on training, just some clarity really. Looking at the first page of that presentation there on mandatory training, it says 17,000 pieces have been completed. I'm assuming that's 17,000 people. I don't know what that figure is. There's some clarity there. I'm just wondering if that 74% complete figure is correct, bearing in mind there's 23,000 overdue. Just that percentage figure doesn't add up to me, but perhaps I'm reading the report incorrectly. And then with the 4,397 total overdue bits of training, I only wondered what process is in place to manage that, and is there a priority as to how quickly that's got to be done, bearing in mind everything else that people are doing, just to understand how you bring down the total overdue number.
Thank you for the question through you, Chair. So forgive me for the detail. I'll have to kind of rely on an update to committee in terms of the detailed points, but just to reassure members, that's 17,000 individual areas of policy compliance, for example, or bits of training that need to complete. So members of staff will have several parts of their mandatory training in order to work their way through. That's the first point. And I will go away and confirm the percentages and how those are kind of added up. Forgive me, I'm not kind of cited on how those figures have come forward. But what I would say is that that's a key element for managers and line managers, service directors and exec directors to work with their teams to challenge colleagues to ensure they are completing it in that way. So whilst we're seeing higher levels of compliance as a result of fleshing this out through reporting, I think clearly we've still got a way to go to make sure that all staff have completed that training in an appropriate way. And just to give you an example of one of the things that we are doing around, for example, there is a move towards ensuring that we're enabling staff to have knowledge of what they need to complete in terms of training, but if they haven't completed it, there are clearly going to have to be a number of encouragements, if you like, to ensure they do complete it. So, for example, for the driving at work policy, if that mandatory piece of training hasn't been completed, those members of staff will not be able to claim expenses. So as part of that, we're making sure that we signal that very clearly through our communication strategy, and making sure that they are very clear that in order to claim expenses for mileage, they'll need to ensure they've completed their mandatory training, because it cannot be true they are still driving for work purposes, claiming expenses for that, but haven't completed their health and safety driving at work policy. So my apologies, members, if that feels very draconian, but you see how we're trying to ensure that there is suitable encouragement, the right level of training and opportunity to complete that training. We've made it as easy and as simple as possible for staff to complete it. But in instances, we do have to make sure there are the right encouragements to ensure they are completing it in the right way. I hope that answers the broad question, and I'll go away and make sure that the percentages are considered and an update provided to committee after the meeting.
So I'm going to ask you a follow up on that one, Alan. So clearly we've got a large number of members of staff currently under consultation. The correct point probably to remeasure what's outstanding maybe after the consultation has closed and the new structure has been implemented, simply from the point of view that if I know I'm leaving the organisation, I'm perhaps not going to be in a hurry to complete bits of training. So I think possibly the right time to sort of get clarity on what is truly outstanding might be post new structure. So will this be re-examined? Will we get more updates to committee to tell us what the progress is after the restructure's been complete?
Yes, Chair. Essentially, I would propose that this audit, or if you like, the information and the development of our health and safety practice, is something that's regularly reported to the appropriate committee. If it relates to the risks associated with the organisation, audit committee feels like the right place. I would also make sure that we follow up with another audit with SWAP within a certain period of time. I'd welcome a view actually from audit committee at some point in the future about when you think that appropriate time is. I would argue that now is not right because we're still working through the actions, but I certainly welcome the opportunity for audit to give advice on when they would like to see another a follow-up associated with this.
Okay, members, over to you. Stick a straw man out 6 months. Does that feel like an appropriate time frame? End of Q1, and end of Q1 next year. Does that sound? Sorry, well, end of Q1 this year.
End of Q1 25. Yeah.
Yeah, that's fine. So that would be what, June, July. So about 6 months from now, roughly. Is that reasonable? Yeah.
Thank you for the guidance, Chair. I'll discuss that with SWAP and make sure that's in our audit plan, and I'll confirm back at the next meeting or as part of the notes of this meeting, just to confirm that's achievable based upon the resources within SWAP. Thank you.
Bro, thanks. So I think Habib, you had your hand up earlier on, and then I've got a question for Alistair.
Thank you, Mr. Chairman, and very well done, Alan, for getting the safety portal receiving national recognition by developing this HNS application that replaces the two legacy system, saving us £50,000. A couple of questions. Is that saving going to improve future services? Number one. Number two, are you satisfied that with the reorganization of the council, we have adequate trained staff to oversee the performance?
Thank you for the question, Habib. Certainly, in terms of the £50,000 worth of savings, they have gone into the savings that are required in order to balance the budget. That was part of last year's budget setting, so that saving has already been taken as part of that process and has contributed to the overall budget. So that's the first point. So I wouldn't say it's necessarily gone into improving, being reinvested into improving services. However, what I would say is the two legacy systems that we had were incredibly cumbersome. They didn't talk to one another, and there were different practices and procedures associated with them. I think what we have now is something that's very dynamic and actually can be adapted and adopted differently depending on how the service is required to use that. And we have the expertise and the talent within the organisation, and we'll retain that expertise and talent as part of the restructuring to ensure that we can adapt the system. I should also say as well, I'm taking the kudos here for the system. All credit to colleagues within the ICT team, part of my ICT team, but also to Daniel himself, who's really kind of led this from the front. So I'm afraid I can't take this one, Chair. This is certainly something that Daniel and our colleagues in ICT have really led the charge on, and all plaudits should go to him for that. In terms of the second question in relation to, am I satisfied that all staff are adequately trained and in place? I think to follow up with the question that was asked by Councillor Rodriguez, I think given the fact that we haven't got all of the training completed and we still have a number of pockets that have to complete that mandatory training, I think my answer to that can only be no, because the evidence would suggest there's still some gaps. What I am confident is, though, we're on the right trajectory, and we have the right management practices and behaviours in place to ensure that health and safety is higher up the agenda. Clearly, we need to ensure that we are encouraging staff to complete that mandatory training to make sure that I can answer that question confidently, and I hope to be able to do so as part of that follow-up audit in Q1 2025.
Thanks, Alan. Alistair, I just wanted to ask you a question about the table on page 22 of the agenda pack, which is the sort of summary of the presentation which follows. So we use a scoring system of 2 points for an agreement and -2 for disagreeing. Makes it actually quite difficult to interpret some of the results. Is this the standard system that you would use in these reports? Because obviously, with health and safety, I'm concerned if I've got half the people in the room that agree and half the people in the room which disagree, because that gives me a score of 0. Whereas if I've got people who are neutral and one person that's saying, well, I don't really agree with that, that gives me the exact same score overall. So could we perhaps move to a different system where we don't use the negative numbers? That way we can see the median point. So that gives us more of an idea about where the sort of true balance of opinion lies. Would that be possible?
Yeah, certainly, Chair, that is possible. It was coming up with a way that was give some meaning to displaying the results from the questionnaire. Clearly, obviously, from your view, it could be better. So I have spoken with Daniel around this questionnaire because there will be merit in running it again in the future. And just to pick up on the point about health and safety in Q1, if you do remember back to the internal audit update reports that you get, and agreed with Alan that, yeah, we have got a health and safety programme built into the audit programme, which included this governance review. And we also have built in at some time in the future to do a compliance review. So there is time built in the plan that we can use and allocate to pick this up. I'm not sure if the timing will be right to redo the survey in Q1 at that point. If it is, then we will do it. And obviously we will use a new scoring system to make it clearer for you.
It's just, I'm not sure on the scoring system whether I'm in a minority of one there. It may just be me that thinks that, and I wouldn't want you necessarily to do a load of extra work that people don't agree with. General nods of assent. You agree, Lee? Yeah,
I do, Chair. I think it would be, it is slightly confusing, and I don't know whether it would be an idea to have a 1 to 10 scale. So you have 10, 9, and 8 real positive, what we would call promoters, and then sort of 4, 3, 2 detractors, and then in the middle you'd have passives. But at least from a 1 to 10 scale, you've got an idea there clearly who's positive and who's negative on any result on variance.
Okay, so maybe we can look at that for next time the report's run. It was just a minor thing that was bugging me, that's all. Right, so are members happy to note the report overall? Yeah, perfect. Thank you for the hard work. Can you pass on our thanks to Daniel, and hope he feels better soon. Thanks, Alan.
Thank you, Chair.
Perfect. I should have said earlier on as well, we're going to have a guillotine on the meeting, so it's going to stop at 12 o'clock today. We've got members that have got to be at a fire service authority meeting in Devon, so there will be a hard stop on the meeting at 12 today. Okay. So moving on to item 6, which is the adults and children's review of priority 1 internal audit management actions. I believe I've got Claire and Mel joining online. Is that correct? Yeah, no problem. We'll give them a moment. Do you want me to move on to anything else, Helen, while we wait? Oh. Yeah. Good morning, Claire.
Morning.
So just waiting on Mel to join. Alistair, do you want to introduce the report, and then when Mel joins us, we can fold her in.
Thank you, Chair. Yep, so you requested an update on all the priority 1 recommendations for adult and children's services. So just for the benefit of the audit committee, obviously part of your role is to give assurance to full council that governance, risk management and internal control is working effectively in this authority. And you take your assurance from various sources of information, and one source of assurance that you take is from the role of internal audit and the work that we do. When we do an audit, we issue a number of recommendations and actions, and they are given various priority ratings. Those priority ratings are listed there on page 98. And obviously the priority 1 actions are the most important, and hence why they're the ones that are paid most attention to. So this report summarises all the priority 1 recommendations relating to adults and children's since the authority went live on the 1st of April 23. So it includes those that are outstanding prior to the 1st of April 23 and any new recommendations and actions that have been agreed post April 23. In terms of our internal audit approach, obviously anything that we give limited or no assurance to, we do follow up on those areas, and we'll give assurance that the recommendations have been implemented and the issue has been addressed. So this report provides a summary of all those audits that have been undertaken where priority 1 recommendations have been made, as I say, since 1st of April 23, including the legacy ones. And that is summarised on page 99. Then the individual actions are summarised on pages 100 down through to page 105. It includes the progress comments from management on where they are and which ones are outstanding. So happy to hand over to Mel and Claire for any questions that you may have specifically relating to those actions and recommendations.
Good morning, Mel.
I am sorry, I'm in County Hall and my computer's just crashed, so I'm on my phone for a second.
If only we had the head of IT somewhere. Sorry, Andy. Mel, so if you wanted to provide any intro, particularly on your area of responsibility, if there's anything particularly you want to draw our attention to.
So in terms of audits for adult social care, and we will eventually do housing, but we won't deal with that today. I think we're probably now on track with all of them, and all that have been completed so far. What we've done with the one audit around quality, we have made sure that now fits into our workforce board, and that our workforce board oversees and makes any changes necessarily in that audit. All other audits, we have now picked up all of the outstanding actions and have been completed. I think you've still got on there something for Athena, and Athena contract has ceased quite a long time ago. The learning for, it must have been a year and a half ago now, the learning from that contract has been built into the way in which we relet contracts going forward. So I think that's probably closed as well. Other than that, I think we are as good to go on all of our audits at the moment.
Okay, thanks. So Claire, moving on to children's, do you want to talk us through any of particularly the outstanding priority ones, particularly anything that gives you concern at the moment?
Yep. So the actions that are outstanding for children's services largely relate to the SEND system and the working of the SEND casework team. The SEND casework team is part of the restructure for education services because we completely accept that that structure does not work in its current format. So some of these are in progress and on hold while the restructure takes place, and we're taking account of these audit actions in the restructure to make sure that actually the system works. The other elements that were in progress are largely around PRUs, so pupil referral units. So all the pupil referral units now have what called core groups in place, which provide accountability and oversight from a range of professionals to check that there's progress being made and to manage risk in those settings. We also have a PRU advisory group, which is like an umbrella group across the PRUs. That's met twice in this term. That's local authority staff, some stakeholders, and the head and the chair from every PRU. And that's reviewing the function of PRUs in the system. And it's the vehicle we're going to use to agree systemic change to the purpose of PRUs, the funding, the way we fund it, and the practice in PRUs. And we've already agreed to take forward changes in relation to outreach funding, which is in train for the start of the next academic year. We know that the contracts and actual places occupied across the PRU state are not well delivered or well overseen, so commissioning are reviewing that for us. And we think we're well below agreed levels of places, and we're looking at how we can address that from April 25. We don't have the right data because of some issues with capita system, which is a national issue. So that's hampered our efforts to try and reconcile the numbers of places and the number of pupils in some PRUs. So it's a very manual exercise, which is now in place. We're confident we know who's where. And we've also got different approaches in the different PRUs to how they are dealing with those children and doing the outreach work, which we're trying to pull together at the moment into a consistent approach using that PRU advisory group to get a more consistent approach. And in the restructure, there will be a team of people who are working with the PRUs across the system rather than in individual areas, which will also give us greater consistency and better understanding of the data.
Okay, thanks. So opening the floor to members for any questions or comments on those outstanding items. Habib?
Thank you, Mr. Chairman. Just a matter of interest, this question is for Claire. Has the reorganisation of children education and family covering EHCP affected the way the end users perceive the performance? What I'm saying perhaps is how are we doing with the staff retention? Because this part of the process is so important that we retain the ability of those staff that have been actually in place. And if through reorganization we lose, or we tend to lose, some of the more knowledgeable staff, how do we actually overcome that gap?
So the consultation is obviously an internal process in terms of restructure, but we have run I think it's 4 sessions with head teachers online to talk to them about what we want to do in that consultation in terms of the impact of consultation and the improvement in support for schools and families. Those sessions have been very positive. We've also run 2 sessions for both schools and parents together, and I have chaired those, and over 400 people have attended those sessions. We've had a really good conversation about what that will do in terms of that. So the main thrust of this is moving staff out of County Hall basically into areas around schools so that staff are more easily available to schools and supporting groups of schools in an area so that people start to know each other and get to know each other across the system better, so they respond more effectively and respond better together. In terms of the staff in the SEND system, those staff in the SEND casework team will also be locality based. There's a lot of enthusiasm for that, being part of a multi-agency locality team. So in terms of staff retention, we do have a high turnover in the SEND casework team. Because it is a very difficult job, I think it will become not necessarily an easier, but a more satisfying job when people are in locality teams and actually working with the schools directly and building relationships with those schools, and with their colleagues in social care and in other parts of the system, so they are actually actively supporting and getting better information about the children that need that support, and for the assessments that need to take place.
Happy Habib, do you want to follow up?
If I may come back, so if you are having all that information in hand, can you tell us perhaps in the last 2 years if you have seen an increase in number of people actually seeking that sort of services, and by what percentage, and what sort of impact will that have on our budget line year on year?
I don't understand the question. Sorry. The number of people seeking what services, and which people are we talking about?
People receiving the SEND.
So people requesting plans for their children? Is that what you're asking?
Yeah.
So in terms of the number of plans in place, the number of plans issued every year is fairly static. So the number of plans is going up because children are entitled to keep their plan effectively till they're 25. So we're not ending plans very well as children get older, because children and young people still need that support. But the number of new plans is fairly consistent. So what we're trying to do is support families and schools in the new structure, when we've restructured in April, is to support mainstream schools to be able to educate more children and to provide more funding earlier, so that those children get the best support possible in a mainstream school wherever that's possible, so they stay as part of their peer group and part of their local community, so that they become more resilient and more able to work with their peers and live in their local community. Because we can see that where children have to go out of their local community into specialist provision, that sometimes those children get quite isolated and their families become more isolated, dealing with very difficult problems on their own.
Thanks, Claire. Diogo, you wanted to ask a question?
Thanks, Chair. Yeah, just on the in progress EHCPs, just obviously I'll keep an eye on that over the next few months and see how that progresses. In the report, it says that the target implementation dates are agreed between SWAP and the service manager. Just for my knowledge, are the revised due dates also agreed by SWAP and the service manager? Concern about the EHCP due dates being later than originally set in place, because clearly, well, I assume that will have a knock-on effect on the number of EHCPs put in place, and we know that the figures at the moment aren't very good, and we know the additional pressure incoming from changes to private schools, as we've seen Surrey running out of state school places, and we know there are a number of SEND students going from private schools to state schools who require the extra support. So there'll be additional pressure added in the next few months as a result of that change, and I just feel like perhaps there's unforeseen pressure, and I just wonder if that's taken into account as well in this.
So in relation to children in private schools moving across to the state sector, we were anticipating that, because obviously we have quite a significant proportion of children in the independent sector in Somerset. We haven't seen that yet. We've had a few inquiries, but a very low level of inquiries. So it's not at the level that we were expecting it to be. We obviously will keep an eye on that. We don't have that many children placed in the independent sector who have an EHCP. So we're not expecting that to be particularly different. And the government has talked about the fact that if a child has an EHCP, that child's education would not be subject to the increase in or the reduction in tax relief effectively for independent schools. That hasn't come through in any system very effectively yet. It's not very clear in the Children's Wellbeing Bill that was published earlier this week, so we're waiting for further guidance on that.
So, Chair, just the first question was the changes with the original due date to the revised due date. Are those revised due dates also agreed between SWAP and the service manager?
So, Alistair, probably best placed to answer that question.
Thank you, Chair. So the short answer on the revised due dates is no, it's not something we're consulted with. This information is pulled from IdeaGen, where officers can change the due date. What I would say is, as part of our annual report, we do look at the movement in dates, and that is reported in our annual report. And obviously, if dates are constantly being moved and slipped, it is something we reflect on in terms of what our view is in terms of the internal control environment. So those of you that were at the August Audit Committee where I presented the annual report will be aware, where I provided some stats on the changes and on the due dates and how quickly recommendations were being implemented. And I know it is something the authority does want to improve across all recommendations, is making sure that they are hitting their target dates and there aren't revised dates going in.
Okay, Will.
Yeah, very briefly, just to follow up on Habib's point, and I just wanted to be clear. I'm a governor of our local school, and there are about 180 pupils in it. And at the last governors' meeting, we had a special needs report, anonymised, of course. And out of the 180 pupils, 30 have identifiable special needs. That's 1 in 6, and I think my jaw hit the floor. I think 5 have plans, and 1 is going through the process at the moment. What I wasn't clear from the answer given to Habib was whether the static number of plans being dealt with was due to a static level of demand, or whether it was just down to the resources we have and the pace that we can work at, and that behind those figures there is a significant level of demand that is not being met. I wasn't clear on that point.
Claire, are you able to provide the assurance for Councillor Wren?
I can give a description. I'm not sure if it's assurance. So every time a child is identified as having some additional need in school, the school would try to work with the parent and other professionals to address that need internally in the school. So where you were talking about 24 of those 30 children not having a plan, but having SEND needs, they would be at the lowest level with support from the school. So there's no application being made for an EHCP because the school is managing that SEND need within the school. When somebody, a parent or professional, applies for an EHCP, there is a process, a panel, which looks at whether the legal test for an assessment for an EHCP is met. In Somerset, we would always ask schools to go through what we would call a graduated response, which I suspect you're aware of, to make sure that they have looked at the internal resources, they've made assessments of that child's needs to assess whether that child could be supported at an earlier point in a more preventative approach, or whether there is a requirement for an EHCP assessment and for that child, therefore, possibly to have an EHC plan issued. If there's an agreement for the child to have an assessment, the assessment process takes place. That number of children who go through that assessment process, as I say, is fairly static. And then there is another process at the end of that in terms of what the assessment says and whether there's an agreement for the local authority to issue that plan. So in terms of the numbers going through that system, the numbers of children going through that system is, as I say, fairly static. I think there are a lot of children in that early stage, in terms of the prevention stage, of having additional need. But to be fair, that is where we would want children to be. We would want schools to be able to manage that with support. They can have financial top-ups in order to support them to manage that child at an earlier level, if that's the most appropriate thing for that child.
Okay. That's great. Thank you very much.
Thanks, Will. Simon.
Thank you, Chair. Claire, good morning. What is the timescale between a request for additional help for a child and that a plan is written, if indeed, going through the stages you've just described, an EHCP is then seen to be the best way forward? What sort of timescale does this take?
So the national guidance is that from the time of applying for an EHCP and that being issued, it should be up to 20 weeks. We don't meet that all the time, and it is very variable. So at some points in the year, we are in some of the best in the southwest and in the country at sort of 60–70%. But at other times of the year, and most recently, we've been at 20–25%. I think we were 26% of the last quarter. It's affected by things like what we were called phase transfers. So every time a child moves between a school stage, so infants to primary, primary to secondary, secondary to FE to college, there is a requirement for us to review their plan to make sure it is the most appropriate plan for that child to move into the next phase of their education. There are a lot of children who move phases every year, and when we do that work for those children in terms of reviewing those children, it tends to take the capacity of the team down to do the ordinary work for doing the basic assessment of need as a new EHCP assessment. Yeah, so it's variable in terms of our compliance.
Thanks, Claire. Simon, I'm just going to focus us back on the priority one action report. So if anyone has got any further questions on the specifics around SEND, then you're welcome to go to children's scrutiny. So I'm going to stop discussion on the specifics there and focus us back on the priority one report. So this is about how we close the loop with internal audit. So internal audit go in, they do the review, they set out some priorities. What we're trying to do here is check that those recommendations are being implemented and that we're closing the audit feedback loop. That was the purpose of this report here today. So if any members have got any questions specifically on that, Rosemary?
Yeah, I hope it's on that. I had a question on page 105 where they talk about the deficit recovery plan. There's no indication of on this report. Is this a large deficit on all schools or a small deficit? Because it says introduce a clawback mechanisms, recover the funds schools are not using. Does that mean there is a lot of money out there that schools aren't using?
So I'm sure one of the officers will stop me when I go wrong, but essentially this is the high needs block of the dedicated schools grant. So the money we receive from government to pay for education, there's a specific section that's set aside for SEND, and that amount is not large enough to meet the costs of provision. So we end up, as Somerset Council, funding that. It doesn't show on our balance sheet because of this, that we have something called a statutory override in place, which means that it doesn't show as a deficit on our books, but it's still real money that gets spent. This is really complicated because I don't really know how we can spend real money without it showing somewhere. But there we go. So the DSG shortfall is not uncommon. Well, in fact, it's the same for all upper tier authorities everywhere at the moment, as far as I understand it. Liz, correct me.
Yeah, Chair, there are differences across the country. So the DSG deficit tends to be higher in what I'd call the leafy counties. That seems counterintuitive. One might expect that it would be higher in inner city areas where there's greater deprivation, but in fact that's not the case. It is one of the big risks for this council and is referred to and discussed and considered at executive on a very regular basis. The other thing that I think we have missed, and it's a really simple thing, is that the number of EHCPs in Somerset is very much higher than it used to be. And again, that is covered at children's scrutiny regularly. The whole subject is.
So I was going to probably ask for a discussion on the dedicated schools grant and the high need shortfall at some point in early 2025. So I think probably the best time to look at that and what impact that has on the council would be then, Rosemary, if that's okay. Yeah. Okay, so are members happy to note the report and move on from here? I think what's clear from the report is that some progress has been made. There are obviously still a number of outstanding actions which we need to keep an eye on. So I'm presuming that the plan is to bring this back to committee later in the year to keep us updated on that progress. Alistair, is that?
More than welcome to bring an update report. I will just remind the audit committee, obviously, any audit we give limited or no assurance to, we do provide a follow-up and obviously report that follow-up to you so you get the full detailed report as well. So there is a loop there, hopefully covering the areas of weakest control and governance in the authority that you're getting that assurance. But happy to bring an update report back specifically on this.
Thanks, Alistair. Thanks, Mel. Thanks, Claire. Right, going to move on then to item 7, which is the update on the 23/4 IT audit report. And over to Andy. Welcome, Andy.
Hi, everyone. Yeah, so I tried to translate the Grant Thornton into something a bit more readable because there's quite a lot of technical terms in the original report, and give an update on the progress we've made on the major sections. I don't know if anyone's got any specific questions about any of them. We've made good progress in some areas. Some of the things we're kind of putting down as a priority because we've got this app consolidation around Revs and Bends. Quite a lot of the issues are around the Revs and Bends system. So some of them we're waiting on progress on that. So I didn't know if there's any specific questions on or any queries from what I put in, or whether you understand it, whether I've managed to translate it from some of the technical terms, especially in the SAP area. It had quite a lot of weird naming conventions in there, wasn't there?
Thanks, Andy. So I'm sure not all of us have got the technical knowledge in this line, in this particular area. Would be really handy to have a cover report for that. So I will ask a question on behalf of Steve Ashton, who has raised this with me separately, but isn't here today to ask the question himself.
Okay.
Which is around the segregation of duties. This has come up a couple of times in external audit reports. And what
in general, or in a specific in what one area?
Well, it's specifically, generally in IT, but specifically within Dynamics, is my understanding. He's got concerns that the segregation of duties isn't clear enough, that there needs to be more control internally. He's more of an IT expert than I am, so he would be able to provide you with greater specificity than I. But can you give us some assurance around?
We are looking at that. There isn't anyone in the IT side that has access to live, so that it's that difficulty in that people who are supporting a system do need access to test it in the test system, but we keep them away from live. The way that we manage Dynamics now is a combination of people from Nikki's area and people from my area, and obviously there is that difficulty if someone is supporting a system but also doing a day job. How do you give them the access to do their day job but also access to support things? So we are looking at that. I think it says in there we're looking at a matrix of who's got what, so we can look at how we can mitigate that or whether we can reduce it. And then one of the ways we do it generally around segregating duty is don't give someone the access all the time. They have to apply for it when they're looking at something. Like if they're doing a support call, they might get the access that breaks those rules, but then it gets taken away. And I think generally down the bottom of the report, we're talking about Active Directory. We kind of give people access for a day and automatically take it away. So that's what we're kind of looking at across the piece. But we do have at the moment, especially in Revs and Bends, a lot of legacy systems that maybe don't have that ability to do that because and that's why we're kind of upgrading them.
Thanks, Andy. So I'm going to open the floor to members. So Quill and the Rosemary.
Yeah, just a brief one on the jargon point. Controls are not enabled within SAP to facilitate audit logging. And then it looked under the sort of remedies of it, decision made not to use logging is not possible to monitor the etc. Because it sounds to me as we have a problem. The solution to the problem is causing performance issues, and this has been going on since 2018. So
yeah, this is one of the ones where the configuration of the system that was set up when we came out of Southwest One was it didn't include the full audit. There is kind of a high level audit, but it doesn't do every single table. So if you switch on every single table, you need a lot more disk space to record it, and there is you have to up the kind of performance of the machine, so there would be a cost implication. So there was a decision when we designed that system back in 2018 that trade-off was at the point where we wouldn't go into full audit for every single table.
I just want to know, how big the problem is and what a risk it is, really, because if it's something it looks as if we're having to live with it until we change systems. Is that correct?
And you need to remember that there isn't any finance or procurement in SAP anymore, so the kind of risk is halved anyway. So it's one of those things that's come up, like I said, since 2018. It's the thing about the finance system audits. There is a lot of stuff in there that you can bring up every single year because it's standard, and we don't have the capacity or the money to up it enough to run it, especially as it's kind of like an end of life system, really. And that was the decision we made back then when we configured it. So I think they brought it up every time, and we said that there is that capacity and cost issue that we've made that trade-off with.
So
it would have come if the audit came here every year, which is what it does. It would have been in there every year. So it's kind of a long-running thing.
Well, I just wonder how acceptable it is to have these sort of long-running things going. I mean, I appreciate it's sort of low risk, but I mean, perhaps you hinted that this isn't perhaps the only similar.
But there are other kind of manual checks on people having access to the things you would be logging as well. So
we manage the risk manually then.
Yeah.
Right? Yeah. Okay. Thank you.
And I think maybe that didn't come across in the conversations with Grant Thornton. I think one of the learnings for me was that, again, this was the first one since we joined up. So was that kind of expectation that we'd have gone through this process in the past in some of these other systems? And I think that knowledge maybe was lost or wasn't available, or we didn't get it across to Grant Thornton in that time period.
Thanks. Rosemary and then Lindy.
Yeah, I did have a question when I read this whole section about password integrity. There seemed to be a lack of that over the whole system. That I think that's what you.
I don't think there's a lack in the whole system. I think some of the legacy systems aren't aligned with some of the modern techniques that we're using. So, when you log on to your laptop, there are rules around it, and not all of them from our legacy systems are in place. And the work to do that, especially in the revs and bends areas, will probably take longer than it will take to migrate the system into a new one. So what we're trying to do is set up the new system so it does have what we call single sign-on, which means you sign in once to your laptop and then it takes you into the application. So you've got your strong password. Yeah. But changing it in these systems that we're kind of moving away from will probably take longer than actually migrating them into the new system. But we have looked at who does have access, whether we can put stronger passwords in. And I think that's the sort of thing we might look at post the restructure, because there'll be I think there will be maybe less people with those weaker passwords. So we just need to make sure we concentrate on the ones we need to fix. Does that answer your question?
Yeah. Thanks. Lindy?
Thank you, Chair. Overall, with the IT report, I'm a bit disappointed on the way that it's presented. In general,
that's my fault. Sorry. Yeah.
In general, there's no due dates, responsible people. The management comments does not necessarily address the recommendation. We don't know how severe these findings are. There's no risk rating, high, medium, low. I don't know whether some of these are semi-resolved, in progress, basically resolved, or still in the infant stages. So it's very hard to give comments on a report that's presented in this fashion. However, I've got some questions on the SAP and then on the general section. So just to, my first question would be on the SAP. Is it now only used for HR, no finance related function procurement?
No, there's no finance at all, no.
Okay, that's what I heard. So it's only HR. Okay, but still, I know we've touched on the first issue on the SAP report. It's on page 107, is the segregation of duties. So the configuration and deletion of audit logs under review. There's no assurance, there's nothing mentioned about temporary measures, manual measures. It's just under review. So we don't know whether the same person can still configure and delete audit logs. I mean, that's a serious issue for me with regards to making sure that there's proper audit trails when the auditors come in. The second one is the controls not enabled within SAP to facilitate audit logging. Okay, so we say that it's been addressed with the turning off of the when you turn it on, it will impact the performance. But now what? And that's where it stops. It's been addressed since 2018, and that's it. So what assurance as an audit committee member do I get that it's actually been looked at? I've heard mention of manual processes. Why is it not documented on the report so that we are properly informed of what assurance has been given and what measures has been taken? Then the second last one, the segregation of duty with regards to conflict between change, development, and production. So with the changes, it says that there's 4 users. It just speaks about 4 users that have access if required. It doesn't address the finding. It talks about to segregate between development and implementation of changes. System changes is critical, and we need to have proper processes and documentation in place to address these. So the comment doesn't address whether there is segregation or not. And then the last one on the SAP is the last one on user access in SAP is not timely revoked for terminated employees. And then it just refers you to linked response in general section. But when you read through the response in the general section, it doesn't talk about the revoke of access of terminated employees. It only talks about reactivation. So that comment is not even addressed. I think I'll stop there, Chairperson, and then I've got 2 more questions on the general section. Thank you.
Thanks, and are you able to come back on any of those?
Yeah, so I'll take the last one first. So there has been a review of our levers process. What happens is someone puts in a lever in SAP, and then they have to put a lever in our Halo system to get their access removed generally. There is a disconnect with that. So we've put some manual processes in place that looks for levers in SAP where we haven't seen a new starter or we haven't seen a request in Halo, and then we chase up line managers to get that done. So that has been added. So we are, and the lever process starts in SAP. So if someone is a lever, they will be terminated from SAP. The issue is they're not always, there's a lag between taking them out of the wider system. So there isn't, I can give you the assurance that there isn't people still in SAP who are levers. It's more the time lag between them becoming a lever across the whole of our systems. And we've put manual processes in, so there's a kind of a weekly check of that. So we have kind of cut down the kind of lag between people who don't create both the 2 forms at the same time, if you see what I mean. Does that answer your question on that area?
Chairperson, I think a general comment on all of these would be that this should have been documented in the report before it came to the audit committee. All that's the answers that's been given should have been properly documented in this report. That's my comment.
I thought some of that was, well.
Thanks, Lindy. I think we probably do need to think about changing probably the format of the report to reflect the concerns and feedback that you've given there, which I think is valid. So, Andy, when are you next due to present this report to us?
When do you want it to? I mean, there's a. I mean, I'm not trying to defend myself, but there's a lot going on at the moment. So it's kind of. But if you want me to line it back to because the original report had the red, amber, green, didn't it? And otherwise I didn't do that in there, so So some of these answers are for low level risk, some of them for the high ones. So I can go back to that, but I don't think I'm going to do that January. But
I think we were probably thinking May, well, probably March, April, May, something like that.
Yeah, that's more feasible. Yeah, I think, and I can, and there will be some more progress because it's sort of ongoing as well.
Lindy, comfortable with that? If we look to review the the report format, and give it a progress update report for April, May, June.
Yes, I think an updated report would be better. Chair, while I've got the floor, I just wanted then to quickly touch on my last two comments on page 113. If the member or management can please just also look at these responses with regards to control lapses over user access management. So this is in the general section. Again, to properly look at the management comment that need to address whether formal user access management procedures have been drafted or written, or there's no reference of, I don't know whether it's there now or not. And then the last one is, for me, very, very important with regards to penetration testing. So it just says that penetration testing has been now procured and booked. Have there been, or has there been penetration testing done before by council? What was the results? How serious is it? This is a very important issue for cyber attacks. And it feels like it didn't get the necessary attention. And then, yeah, so basically just to give us feedback, when will this penetration testing happen? For when is it booked? And has it been done before or not? Thank you, Chair. I'm done now.
Thanks, Lindy. So, Andy, can you address the penetration testing issue?
Yeah, we have been doing penetration tests for as long as I've been here. The decision was to do that before we went into the new council. So we made sure we were good before vesting day, and then the kind of timing meant that we didn't need to do another one. Whereas in the audit report they said we hadn't done one since we became a new council. We kind of did it just before we became the new council, and then there always is a process to create a penetration test. It's sort of January time, I think is what it's booked for. So I can give you the full details of the date when it's booked, and then I can update you in the March as to what the output was. So it's not being ignored. It hasn't been done. It was just a timing issue of the way we did it before we became a council, to make sure we were safe becoming a council rather than doing it after the event, because it seemed a safer option to check before and then make any changes before we became the council rather than doing it afterwards.
Okay, satisfied, Lindy, or at least less unhappy about that?
Can I transfer my comment to when we get the updated report on whether I'm satisfied? Thank you, Chair.
That's fine, Lindy. Thank you.
I can share the results of the last one if you like. Is that helpful, or would you just want that in the March report?
I'm more concerned, Chair, through you, that there's not been a penetration test since the new council formed. That's heavily risky to be in a position like this. I understand why you did it before the new council formed, but that's now become irrelevant. I think it's something we really need to prioritize and look into getting these tests done. It's extremely important. Thank you.
Thanks, Lindy. Alan, did you want to, have you appeared on screen because you wanted to respond to any of that, or no, that's fine. I've got a question from Lee.
Thanks, Chair. Sorry, I'm not laughing because no, I do share, Lindy. I do share your concerns, and I really appreciate Andy coming to audit and presenting this. And I think Lindy's right. It's probably in an unfamiliar format that's not helping here, Lindy. And I do agree with you there. And I think for me, I think the big thing would be, obviously with the restructure and everything going on and people leaving, coming, going, there's hundreds of people, concerned potentially. My one concern would be a high risk is the levers and all the levers and shakers, if you like. Are we confident that we've got a process in place. And you mentioned on here that the removal of access and SAP, etc., which is a real sort of complex process. I understand that, but are we confident that we've got a process in place with all these guys leaving the business, that the relevant permissions are going to be removed so that they can't do any jiggery pokery, throw the toys out the pram, if you like, after they sort of left the business, if you understand me. In a previous role I was in, you had the line manager's responsibility to remove access. So if, let's say, Liz Lation was leaving my employment, right, Liz, we get an HR file, remove that, and that. Thanks ever so much. She's gone. Mike Hewison, remove that. He's gone. I'd signed to say it's all been done. So it would be line manager responsibility. I know it's different with the council, but I just wonder if
it still is line manager responsibility. They fill in the Halo leaver form and put a leave date, and then that we know when to remove them. The difficulty is in SAP because it's an older system, we can't link it to the point where they put in the leave date in SAP. So all we know, there's a leaver, and then we have to go back to them to say when is the leave date. So we've put a lot of processes in place, some of them manual, some of them automated, and a few checks and balances. And obviously with the large amount of leavers that's happening in April, there will be a list of leavers. And again, we can check that we've got all those as well, because we want their kit back as well. So it's not just that, there's a lot of kit involved with this as well. So we are on top of this and we are preparing for it, but there isn't a way to completely automate it with the version of SAP that we've got at the moment.
Okay. All right. Okay. Thank you, Chair. Thank you.
Thanks. Well, while we're on that subject, there's going to be a lot of IT equipment potentially coming back, Andy. So what's going to happen to all of that? Does it just get shoved in a cupboard?
No, there's two options. So because we're moving, Windows 10 is going end of life, and some of the devices don't go to Windows 11. So if we're getting stuff back, we can give out to someone as a replacement for their Windows 10 device. We'll do that. And there's a couple of options we can do with kit that's spare. So we can get that either wiped and then it can come back as equipment we can hand out to social care leavers or volunteers, and we've done that over the last 2 months. But there's a lot of small kind of local organisations that we've helped by giving them reused laptops, or we can just get some money back on it and it goes back comes back in as income effectively. So there's two options. What one's the nicer one, and we can kind of help people in the community, or other we can help with our bottom line. But they're not. They tend to be worth about £100. So it's kind of whether you think that £100 is a lot better in goodwill rather than having the £100 for the device.
Who makes those decisions? Is that just something that IT decide, just out of interest? I know we're off subject.
We made the decision to go down the route of offering it out to care leavers because we thought the goodwill was better than the small amount of money we had back. But some of our devices do have a higher value, so it does depend. And we're in a financial crisis, so it might be that we can get 10k back for the ones we get back if they're in an okay state.
Okay. Thank you. Sorry for the digression.
That's right.
Right. Are members happy?
That's good news.
Are members happy to, I suppose, note the report? We will look at the report format for the next time it comes back to committee, and look to address some of the concerns that Lindy's raised there. Thank you, Andy. All right, so just a reminder to members, we've got 35 minutes left. So we'll move on to item 8, which is the Improvement and Transformation Programme Risk Update. Hello, Lou.
Hello, thank you. So this is the latest Improvement and Transformation Risk Update. Report commences on page 115, and it provides an update up to the 10th of December. In terms of the whole programme, we continue to make significant progress across the various work streams. However, our current primary focus is on the workforce programme and the whole council restructure. The full risk report is contained within Appendix A on page 125, and a summary of the risks and the changes since the last update are contained within the main body of the report on page 118. In this period, a new risk has been identified in the reporting period, which relates to the potential extension of collective consultation period beyond the 14th of December. No risks have been closed during this reporting period, and At this point, I'll close and pass over to members for questions and queries. We've obviously got Alan online today, and also Nicola Hawaii from Workforce Programme to support any questions. Thank you.
Okay, so opening the floor to members. So I've got Gwyl, Diogo, Rosemary, did your hand to go up? Would you like to go first?
Yeah. The one that worries me is on page 125, we've got insufficient budget for redundancies, which is rather a worrying line, isn't it? Perhaps you think you can. Well,
Maria's here. Hello, Maria. Hope you're feeling better.
Thank you. I wanted to just to say, in terms of I think it's a risk that there is insufficient budget for redundancies. We do not know that we have insufficient budget for redundancies. There's been a flexibilities in capital strategy that's been updated that council agreed yesterday that identifies I think it's 15 million for redundancies specifically through the flexibilities in capital, but we've also got a capitalisation directive request in with MHCLG over and above the amount that we've got built into the budget for the transformation and funding of redundancies as well. So just so you know, we have there is a risk that there would be insufficient provision, but we've taken steps to mitigate that risk. At the end, when we come to the end of the consultation, we know at the end of the process who is and what the redundancy costs are. Then we will make that assessment and we will advise back. But I'm confident that we'll have sufficient funding, given that I've created two additional routes. We've got two routes to fund that.
Okay, so Diogo and then Gwyl.
Thank you, Chair. Just quickly making one quick note to go back to. So for me, just trying to focus on what we're recommended to do, which is considering the mitigation actions being appropriate or not. Looking at the report, the first question I have is, when mitigation actions move to the bit that says existing controls in place, I'm assuming that means that the progress on that action has moved on to 100%, so then it moves on to that part of the table. And I'm only guessing that having found last month's report and comparing, but I just want to make sure that's correct. And if it is, I think for me it's difficult to track that month on month that has reached 100%, because there are some from last month changing to this month that have moved up there. So just about tracking the change perhaps isn't very clear to me. And then just on two particular references, the ITP 0004, the current score on there is higher than the previous month. Again, not able for me to track looking at this document. I've had to look for last month's one to be able to find that out. And I'm only wondering why that's the case, and if there's any further mitigation required, depending on the answer that's going to be given. And then on number 6, actually, whilst you answer that, I'll try to remember what I was going to say about number 6.
Okay, Lou, Alan, who wants to pick up the question about the tracking the progress with the mitigations?
Shall I start, Chair? And I'm sure Lou can kind of come in. So first and foremost, thank you for the feedback. I think we've acknowledged internally as part of the team that actually is looking at direction arrows to help both our own review of that, but also members' review of that, I think would help. So I think the comment is well made by Councillor Rodriguez. So we'll take that away as part of that direction of travel. But you've seen, and thank you for Audit's comments on the previous reports, we've seen significant improvements in how we are reporting these risks. But a direction of travel arrow, I would concede, would be helpful for members and certainly the programme team to kind of navigate that. I'll hand over to Lou at that point.
Yeah, I take on board the comment about the direction of arrow travel being added. I have to be honest, Liz started talking to me, so I didn't hear all of the question. So apologies. Could you just
So that's
that
okay.
off? Sorry.
That's all right. So it was about mitigating actions, moving to the top bit that says existing controls in place, but I think that's covered, perhaps tracking that month for month. Then a particular question on ITP 0004, again noting that the current score is higher than previous month, though that's not reflected for us to obviously see. I've had to find that, having looked at last month's just now as well, and also a reason for that score going up, which I can't see in this month's report.
Oh, it's working out. So I think we'll reflect on you having to go back to the previous month's report, and it's probably useful that we include the previous month's report in the reporting, so it's easy for you to find. But we'll take that away and look at how best we can facilitate you not having to flick through reports. In terms of the risk scoring this period and the changes, I'd hand this over to Nicola Hawaik for ITP 004 in Dawn's absence.
Morning, everybody. Yeah, so I'm not clear why the score will have gone up. The only reason I can think it may have potentially done is that there has been an increase in pay bill costs, but that was just purely down to the pay award being included, and obviously that has increased our pay bill costs, but there shouldn't be any other reason why that score has gone up. So I'll go back and check that and confirm the detail around it, but we're on track, and all the key lines of inquiry that we're monitoring at the moment are still continuing to sort of reduce. So I can't see why that score has gone up. So I'll have to check the detail around that one and come back on that.
Liz?
Chair, this may be an oversimplification. I thought it was simply because the consultation was extended for another week. Therefore, any of the savings, actually the savings are reduced by having an extra week's pay for any of those posts that are made redundant at the relevant time. But my understanding is notice on redundancy is very different from notice on people leaving a job. And so when I've been asking about how savings are in place for the new budget 25-26, there are redundancy payments that are being covered by our capitalisation directive and/or our capital receipts flexibility, which was included in the Treasury management paper at full council yesterday. And that's what I was trying to explain to Lou, and apologies for taking her mind off what she should have been working on. But that was agreed by full council yesterday. Thank you.
Thanks. Diogo, do you want to come back?
Yeah, just that final point I remembered on number 6, it was just some clarity again, if I may, that the target score for that one's increased from last month, and I'm assuming, but just someone to confirm that may be in regards to the progress and pay part of it. It says on there that the project will take a further 18 months to complete. I just wanted to kind of understand what that means and if there's any further mitigation required as a result of it.
Yeah, I'll pass that over to Nicola to just provide an update on the programme of work over the next 18 months.
Yeah, so obviously the initial focus around this risk is related to the restructuring, but we do know, as I think will have been raised before, that this is sort of the process we're going through now is highlighting sort of some of the issues that we have around pay and grading, which is why there is a separate piece of work that will start from April onwards to look at the pay and grading for the whole council, and that will sort of include looking at job evaluations and looking at sort of mitigating potential risks we might have around equal pay. So that's a huge programme of work. I mean, anyone who's been previously around when single status was in, it's on that size and scale, and that's a project that we'll look to start in April next year.
Thanks, Alan.
Thank you, Chair. And just to add to what Nicola said, this is part of, so the reference to a wider programme of work isn't necessarily associated with the restructuring. This is, as Nicola's just outlined, this is a subsequent piece of work as part of our ongoing review of pay and grading, which was always committed to pre-local government reorganisation, and something that all councils that have been through that process have to go through in order to ensure there aren't any inherent risks associated with that. That project and programme will effectively identify what the level of risk is and how that could be resolved. But at this stage, we aren't able to complete that because we're still going through that restructuring process. So the resources will be moved into that programme of work as part of it. And just a final point, if I may, Chair, the target score is where we would like to get to. So the change in the target score is about what our aspiration of where we want to move to. You'll note that that's been an addition to our reporting going forward. So not only do we set out what the risk currently is, what the mitigated risk is, but also what we are endeavouring to move that to. So if you like, the ambition or the level of the state that we are trying to move to has now been sort of set out as part of this report, and the activity that's there. So there's mitigating actions in order to reduce the score, and then of course the next step is what are the steps to kind of reach that target score, and that's the work that's been outlined by Nicola. Thank you, Chair.
Thanks, Alan. Linda, you've been very patient there.
Thank you, Chair. My first comment is on page 142, ITP 11, Trade Union Relations. The inherent score moved from 12 to a current score of 15, which is not possible. The current score can't be higher than the inherent score. So just to really look at the scoring. And then my second question is on page 127, with regards to the redesign of council does not deliver the required workforce. Looking forward to estimated £49 million of savings with the redesign. My question is just on the new mitigating actions that's currently at 65% with a due date of Monday, the 23rd of December. I see the update was on 5 December. What the position is, are we going to meet the due date? And if not, what would you suggest would be the revised due date? Thank you.
Chair, can I take that one if that's okay?
Go ahead.
Thank you. An excellent question. The purpose of the review date being in place is to ensure that all directorates have completed their reviews of consultation pre-Christmas, in order to ensure that we've got a view of all the feedback that's been received, that we understand the consequences and the issues that have been raised, and whether the matters that have been raised can be mitigated and what the implications of mitigating. We are on track to do that. So those reviews, in fact, my review for my directorate is going on as we speak, in the room next to where I'm sat, hence why I can't be in the room with you today. And essentially, once those reviews are complete, we'll understand how we are responding to consultation, the measures that we're going to take to address it, and the implications of that, both from a structural perspective, but also if there are any financial impacts associated with that. And clearly that will need to be debated first and foremost with ELT, the executive leadership team, and the chief executive, and then ultimately reported through the various member review and decision-making bodies early in the new year. But yes, we are on track, Lindy, to complete that on Monday.
Thank you. Final question on this section to Gwyl.
Okay, I've got one or two questions. I'll submit in order to elicit a quick answer, if I may. On ITP1, the insufficient capital for redundancies, I note the capital receipts are coming in against forecast, but I don't think we can spend the money without the formal government decision that we have the capitalisation directive. What is
So we've got the capital receipts flexibility policy that was agreed at full council yesterday, which does give us the flexibility to use those capital receipts in lieu of the formal capitalisation direction decision from DLUHC.
And that will cover all the redundancies?
Yeah.
Okay, thank you, that's easy. Second thing, ITP3 has got double counting savings. I just wasn't clear how big a problem this was likely to be, whether we're talking about thousands or hundreds of thousands, and just was interested to know who had oversight of this, who's holding the ring on that particular issue.
So happy to answer that, Chair. So this is around just making sure that if services are putting savings forward, that they can be delivered, that they're not double counted for anything that they may be required to deliver this year, and not putting forward the same saving next year. and the finance team, the financial planning team, are overseeing that in terms of those savings.
ITP 9, excessive loss of staff with talent and organisational knowledge. All the mitigating actions have 31st of March deadline, but only 4 out of the 5 have started. Is that because we've only just realised that they're needed, or has this been a delay through other reasons?
Alan, do you want to answer that?
Yes, of course, Chair, and thank you for the question, Gwyl. No, absolutely not a delay. This is simply because at this stage we don't know which staff members will be leaving. We have been running a process whereby knowledge capture has been embedded as part of the voluntary redundancy process. So a toolkit was developed and being utilised by managers. And there's an excellent case study that was published a few months ago now from one of our colleagues in our HR team about how it had been used and how it helpfully kind of enabled staff that were remaining in the organisation to look at the roles and tasks and duties that individual picked up. So we've had that in place for some time. The reason that it is only at that level of completion is we simply do not know until we complete the consultation exercise and finalise the structure which staff will be leaving and what level of knowledge transfer is acquired based upon their knowledge, their expertise and their length of service, for example.
Are we assessing a risk of the level of take-up or engagement? Have we got a sense of that? How many people are likely to cooperate, if that's the right term?
Chair, if I may respond to that one. In essence, that is on the responsibility of the manager, the responsibility of the service in order to ensure that is completed, that they understand that if there is a key member of staff in their view that is leaving as part of this restructuring exercise, that they have undertaken steps to ensure that they have used the knowledge capture tool or whatever they see fit. We are providing that as information and a potential toolkit, but it's their responsibility and their management and leadership responsibility to ensure that that knowledge is captured.
Okay, thank you. ITP 10 appears to be non-delivery of the organisational restructure. Now, it seems to be an overview risk, but it's quite low. It's only a score of 15, and yet I would have thought the failure of one of the risks would lead to the collapse of the whole thing. Have you got a view on that?
If I may, Chair, I think that's an excellent point and something we can review. It's been scored at that level because the progress that's being made associated with the programme overall and the level of risk that we currently see. So we are making good progress. We are broadly within the timelines that were set, and we are still on track to set that by March 31st. So hence why the risk has been scored that way. But we can certainly reflect on that. It's helpful feedback. Thank you.
And the last one is 13 and 14 is the devolution. It looks as if the £600,000 that was set aside for this has not been allocated yet. Does that mean we're going to be taking it as a savings, or are we expecting to spend it in Q4?
Chair, through you, I'll certainly take away the point around the level of expenditure, but my understanding that we have got expenditure associated with that allocation that was made by Executive last year as part of the budget setting, and that has helped and assisted in the delivery of the devolution agreements that are in place with a number of parishes and towns at the moment, and there are a number that are going through into next financial year. And I do apologise if I've spoken over Liz.
Liz?
Not at all, Alan. I was just going to say it's an earmarked reserve. So that is included in the review of reserves that we've seen recently at Executive, and it's still shown at its full amount. But I have checked with Sarah Skirton that it is being drawn on, and I have made the point in my representations to ELT that actually that is really important work, and that it is a priority for this administration to use that money to move the local devolution. I've now started using the terms local devolution and regional devolution because it's becoming really confusing. Local devolution is really important. We understand the difficulties of having enough lawyers working for us because of the issues of recruiting permanent staff. But it is important, and it does need to be used for what it was intended for as soon as possible. Thank you.
Thanks, Liz. Thanks, Will. Perfect. Right, so are members comfortable you've given that a good kicking of the tyres in terms of the mitigations and progress? Yeah. Okay. Fine. We've got 13 minutes. We've got the latest update of the interim annual auditors report to discuss. So I'd ask members to keep your contributions at a high level and keep them brief, if possible. So just for, I suppose, Diogo's sake, this is an update of the report that came to Audit Committee in January. It's been seen periodically where we're tracking the key recommendations made by the external auditors through the year and looking at progress against those priorities. So I'll open the floor to members for comments, concerns. Will?
It's just one I mentioned last time, which is KR1B, the children's 20% was done. I don't think this has shifted since last time. I think the point was made. It was, we have to deliver it by the end of the year. I can't find it at the moment. It's just.
Yeah, it's the end of March 2025. So
there doesn't seem, I mean, all right, we only discussed it about 4 weeks ago, and there hasn't seemed to be any movement on the 20%. That was the only comment I had to make, really. It was a comment more than anything else.
Hi, Sean. Would you like to?
Sorry, I thought it was if it's a comment that's helpful. If there's a specific question, I was gonna preempt a specific question about it. But I have gone back and got the assurance from the service since the question was raised at the last audit committee. There are some MTFP savings at risk, which are reported to the executive as part of the budget monitoring report. Since this report was published, the owner of this action has come back and actually confirmed that there is some movement and some progress now moving towards the target being not the target, the progress bar being increased, and I'm just waiting for some assurance and evidence through the finance business partnering team and the service before that progress is changed, but it should be updated for the next audit committee report, and the service is still confident that the action can be completed by the end of the financial year.
Thanks, Sean. Similarly on KR5, which is the DSG deficit, I would like to spend a bit of time looking at that in January. Liz has already suggested that it's brought to executive anyway, so if we could specifically focus in on that one at a future audit committee, that would be helpful. Lindy?
Just one comment. Finance has been updating this report for us with how far the implementation of the recommendations have been ongoing. And I was just wondering whether Grant Thornton with the backstop order will be looking at the value for money again. Will they, as the external auditor, review the actions that management indicate as being implemented, that it was indeed implemented? I don't know whether they will be looking at the value for money again.
You've rubbed a magic lamp and Barry Morris has appeared. Hello, Barry.
Hello, Mike. There you go. Just proving I am here and listening intently. Thank you, Lindy. So the 23-24 AAR has followed up on the progress of the recommendations. That report is with officers for comment, and we're looking to bring that to the next audit committee in January. But yeah, all those recommendations have been followed up.
Happy, Lindy? Yep. Perfect. Back in the room, any further comments, questions, concerns? No. Sean, was there anything else you specifically wanted to highlight on this report?
No, thank you. Your introduction was perfect, and that was all I was planning on saying. So thank you for doing that on my behalf.
No problem. Okay, so members happy to note progress. I think this has been a useful exercise this year because it's allowed us to really focus in on those top priorities and to see progress as the year's gone on. So I think as a learning experience, that's something that I found helpful. I don't know if other members have found that helpful, but it gives us that longer thread of being able to follow these items through, because it's difficult when you're flicking back through months and months of papers to work out what was agreed at previous meetings. Okay, so I'll move on to item 10, which is the work plan, which I don't think I've got in the agenda pack. So,
Chair, I don't think it got published. I apologise, it got missed off being published.
Well, I'm assuming we're going to meet at some point in the future. So the date and time of that meeting will be published as in the usual way. So
It's 30th of January, the next meeting.
there we go, 30th of January, lovely. So I look forward to seeing you all then. I would just like to say thank you to all of you and to all of the officers involved with Audit Committee this year. It's been an exceptionally heavy workload. We've got through an awful lot of work. Hopefully 2025 will be a slightly different pace and rhythm for us, but I would like to thank you all for your hard work and cooperation. So I wish you Merry Christmas, Happy New Year, and a successful 2025. Thank you all. There is cake available if you do want to stay after with the meeting. Thank you.
Thank you very much.